We need a K-wire. As you can see here, it is threaded. Okay, so we can shorten it a little bit in order to have a good length for our spacer, and then we have to bend the tip. This tip is going to be our hook in the cement, so that when we take out the spacer, we can take out the entire cement. So we normally can use a 3.5 plate, which we are going to bend in order to have the offset of our spacer we want. And we are just going to bend it a little bit in a form that is going to correspond afterwards to our prosthesis which we want. In order to have the length of a spacer which is adequate, we keep this, and at the end we're going to put our plate into this tube. What is very important is that we have to make it in a powder form so that it is not too crunchy. If we want to have very good quality cement with antibiotics, we're going to start with a fractionized mixing. We only use a little bit of cement, and we use almost the same amount of antibiotics, and then we start already mixing it in order to have really well mixed cement. Once we have done that, we start taking again a little bit of powder and a little bit of antibiotics, and we mix it again a fractionized way in order to have the best possible quality of cement. Then we take again some cement, we take the rest of our antibiotics first part. Here you can see we're really trying to have a mix which is as standardized as possible. Then here the rest of the other antibiotics. Here we have put almost all of the cement in, and now we have mixed 40 grams of cement with 2 grams of Vanco and 1.5 grams of tobramycin in a fractionized way, and you can see that it's very homogeneous cement mixing. Okay, once we have done that, we can put in the cement in our syringe. The rest we can use afterwards. And we inject the cement in the tube. Once we have done that, we can put in our plate in the tube. From the other side, we put in our KY to have a stronger construct so that it can't break. And then we can here take the rest of the cement and already put that around our plate. We take the liquid, we take the cement, as soon as we cannot see any powder anymore, at that moment we start putting in our antibiotics. There is big inclusions of antibiotics in our cement, which leads to bigger elution or burst elution of the antibiotics out of the cement at the initial phase. Of course, this cement here is not indicated to be used if you want to have a definitive fixation of a prosthesis, but only if you want to have a spacer that we're going to take out quickly. The size of the head we're going to use is going to be the size of the reamer which we used to ream up the cavity in our infected joint. If we reamed the cavity until 54, we're going to use a reamer of 55 and 56 because this is going to give us the chance of having the adapted size for our spacer. If you can see here on the surface, there is all these antibiotic granular which are there, which are going to be eluted very quickly once the spacer is in the patient. The head starts sticking. You're going to take the next size, you're going to wet it a little bit, and then you're going to do it until it has hardened out. Then, once the cement has completely hardened out, you take here a knife, you open up the tube, this is the cement spacer. You can see the length you can choose on if you have had to do an osteotomy. Very important here at the end, you can just see it's the K-wire. So if it should break at the interface between the plate, which ends here, and the rest of your stem, you still have your K-wire on which you can pull out the rest of the cement. So this is very important. And here you can see once again all the little antibiotics which are here. And the more inhomogeneous the surface is, the bigger the surface, so the more elution you're going to have. And this is how you can do a cement spacer with antibiotics.